Parhar. I'm the clinical head at Oasis I'm the clinical head at Oasis Fertility, Secunderabad. And today I will be talking with you all about secondary infertility, its causes, evaluation, and the treatment options. Now, what is secondary infertility? As we all know, infertility is a condition where a couple which has been trying for pregnancy for more than a year by practicing regular unprotected intercourse is unable to conceive. There are two types of infertility. We call it primary when the couple has been unsuccessful at having any pregnancy at all. And we call it secondary when a couple who has been trying for more than a year is unable to conceive, but this particular couple has had a pregnancy in the past. So, secondary infertility is seen in those patients who have managed to have a pregnancy in the past, but when they try again, they are unable to conceive despite having regular and unprotected intercourse for more than a year. Now, it's a very, very frustrating and a very depressing diagnosis because the couple as such is unable to understand that what is wrong. Most of the time, such people are usually the kind who would have had absolutely no problem in conceiving the first time. And when they try again, it becomes almost impossible. So what could be the possible reasons? Now, the incidence, or we would say the prevalence of primary infertility, if we were to talk about it, is say somewhere in about 1 in 5. So you can expect about 20% of our patients would be suffering from primary infertility. Whereas as far as secondary infertility is concerned, in our OPD, we see that about 1 in 6 couples will be such who had a previous pregnancy but are having difficulty in conceiving again. Now, in most of these patients, about 30% of these patients, it's usually a female factor which is responsible for the infertility. In another 30%, it can be a male factor. 10% of the cases, it's both a problem with the male as well as the female. In 25% of the cases, it's unexplained. We have done all possible tests and still we don't know what's wrong. And in about a 5%, we really have no answer whatsoever. So, if we were to look at the causes of secondary infertility, so the first thing which we have to understand is that what are the prerequisites for a normal pregnancy? What is it that we need to function in order to conceive naturally? So for a normal pregnancy, as most of us know, the couple needs to have normal reproductive organs. They need to have fully developed uterus with the female needs to have fully developed uterus with 2 fallopian tubes and 2 ovaries. Now, in ladies, we are born with a fixed number of eggs, and every month when we get our periods, there is an egg or 2 which is released somewhere in mid-cycle. This egg, when it's released, it's live for about 12 to 24 hours. Once it comes out of the ovaries, it's picked up by the tubes, and it's in the tubes that it meets the sperm if the couple has had intercourse, say about somewhere between 3 days prior to up to about 24 hours post-ovulation. And it's in the tubes where the sperm and the egg meet, and then they come and implant in the uterus as an embryo. So as one would expect for a normal pregnancy to happen, we need normal ovaries which ovulate regularly. It should be releasing a healthy egg. The tubes need to be patent and fully functional. The uterus has to be normal in size and it should be functional and responsive to the hormonal changes in the body. And the sperm has to be of good quality. So, obviously, when things are wrong with any of these parts, it can result in infertility in the couple. So, if we talk specifically about secondary infertility, the common causes for it are advanced maternal age. So, one of the most common causes is increase in the maternal age. So as I was just talking, that ladies are born with a finite number of eggs. And as our age increases, our chances of conceiving drastically reduce. The reason being that the quality and the number of the eggs reduces drastically post 35 years of age. And this is the most common reason why we see infertility, secondary infertility in our patients. By the time they realize that they would like to have a second child, it's most of the times quite late. And obviously the eggs are not as healthy or as good quality or as many in number as they were when the couple conceived the first time. And this is one of the most common reasons why they end up with infertility again. Another common reason is an impairment in the sperm production or the sperm count. Just because there is no problem in conceiving the first time doesn't mean that it's going to be all easy the next time as well. Time usually is not kind to either the male or the female partner. So with time, there can be a lot of things which can bring about changes in the sperm quality as well as the number. Suppose the male has been subjected to some endocrine changes, or there's an increase in weight, or he has been using some medications, or even stress for that matter. All these things are associated with a decrease in the sperm production as well as in the sperm quality. Another common reason for the rising trends of infertility in couples after their first pregnancy is the damage which is caused to the fallopian tubes. The damage can be secondary to some sort of infection, or it can even be the result of some surgery which the couple might have had. A number of times we have patients coming to us who after the first or the second child decide that they don't want to have any more kids. But then when they go ahead with the tubal ligation procedure, which is basically a type of sterilization surgery. And later, because of whatever changes in their circumstances, they want to go ahead and have another child. But because of the damage which is caused to the tubes, they end up suffering from infertility. So that can be another reason why these couples might find it difficult to conceive. Endometriosis is another common cause. Now, what is endometriosis? Endometriosis is when the normal lining of the uterus is found in an abnormal location in the body. And this particular condition is usually associated with a lot of inflammatory changes in the body, as a result of which there will be a lot of adhesions which would be caused. So, endometriosis is usually associated with obstruction in the tubes, and it's associated with difficulty in ovulation. And patients suffering from endometriosis quite often present with infertility, either of the primary or the secondary kind. Patients might also develop polyps and fibroids, which might be responsible for them developing secondary infertility. As the female's age increases, they are more prone to developing conditions like fibroids in the uterus or polyps of the uterine lining. And these tend to become a physical barrier to the whole process of conception. A lot of times we also see that a patient, especially the females, tend to put on some postpartum, they tend to lean towards developing some postpartum weight gain. Now, if you have a tendency for polycystic ovarian syndrome, this can severely impair your chances of conceiving. Because as we know, as most of us would be knowing, that polycystic ovarian syndrome is a condition which is worsened by weight gain. So it's a condition where the patient has difficulty in the regular release of the eggs on a monthly basis. And in these patients, they would be having problems with ovulation. The more the weight gain, the more difficult it becomes for them to ovulate. And that would be a possible reason for them developing secondary infertility. It's not just the females who develop infertility secondary to increase in the weight. Even the male partner, if they have excessive weight gain, it might lead to hormonal imbalance, which in turn might impact their sperm production and lead to difficulty in conception again. Lifestyle factors like excessive smoking as well as heavy alcohol use in both the male and the female partner are also responsible for decreased fertility trends and are detrimental to your fertility chances. The use of certain medications like antihypertensives by the male partner may also be responsible for infertility because they tend to lead to erectile and ejaculatory dysfunction. So these are some of the factors which might be responsible for secondary infertility. Now, here I would like to discuss about a condition which we are commonly observing in a lot of our patients. As we all know, there has been an increasing trend in cesarean sections nowadays, and we see a lot of patients who had a previous cesarean section facing secondary infertility. That is, these patients did not face much trouble when they conceived the first time, but they're having issues when they're trying to get pregnant again. Now, in a lot of these patients, what we are observing is something called as an isthmoscene. And an isthmoscene is usually, what happens here is that you have a niche which is created at the level of the There's basically a defect which is present at the site of your previous cesarean section scar. And there is some blood which gets collected here at in every menstrual cycle when you bleed. And this tends to flow backwards into your uterine cavity and impair your fertility. So we have a lot of patients who had previous cesarean scars who present with infertility, and in quite a few of them we see this particular reason responsible for their secondary infertility. Now, besides these things, so how do you really manage these cases? If you're someone who's suffering from secondary infertility, when do you really need to seek uh, a doctor's advice? When do you need to really look for an evaluation and further treatment? So if you're less than 35 years and if you have been trying for a year or and above with regular and unprotected intercourse and you're having difficulty in conceiving, it's time to seek medical attention and get yourself evaluated. On the other hand, if the female partner is more than 35 years old, in that case, because of the declining fertility, you need to seek medical attention earlier when it's been at least, when you've tried for about 6 months or more without much success. What is it? How do we really tend to help these couples? First of all, we would be obtaining a detailed history for you. We would be examining both the male and the female partners for any signs of any hormonal imbalances like excessive hair growth on the face or any signs of insulin resistance. We would be checking their weight and their body mass index. After a detailed history, we would be looking at doing a transvaginal scan for the female in order to rule out any anatomical pathology which might be responsible for the secondary infertility. So what are we really looking at in the scans? In the uterus, we would be looking for any obvious fibroid or any polyp which might be impeding your fertility. And in the ovaries, we would be looking for any endometriomas, or we would also be checking for your antral follicle count, which is a marker for your ovarian reserve. Now, this particular test in females is to be done on the second day of their period. That's the best time to check what is your antral follicle count, which in turn gives us a hint as to what might be your ovarian reserve. And based on that, we can decide how much, we can plan out your treatment protocol according to your ovarian reserve. As far as the male partner is concerned, we would definitely like to have a look at your semen analysis parameters. So for that, usually the male partner is asked to give a semen sample with a 2 to 7 day abstinence period, and based on that we can decide whether the parameters are within the normal range or not. If everything else is looking fine, we would like to evaluate the tubes in case of the female. Now, the tubal evaluation is usually done by means of a dye test, which is known as a hysterosalpingography, or we can also do a saline infusion salpingography. And what we do here is that we instill a dye inside the uterine cavity, and when the dye spills out from the fallopian tubes, that's when we take a radiograph or an X-ray film. And based on the level of the dye in the film, we can decide whether there's a blockage or the tubes are patent. Mind you, this is just a test of the patency of the tubes. It does not tell me whether the tubes are functioning properly or not. We can also do some tests like hysteroscopy or a laparoscopy in some indicated cases in order to arrive at a diagnosis. So these are some of the tests which we commonly do in order to evaluate a male and a female who presents to us with secondary infertility. Now, besides these tests, we would also, based on these tests, we would like to do the management protocols, decide on the management protocols for the couple. Now, what are the treatment options which are available for someone who's suffering from secondary infertility? Based on the results for the evaluation, you might be given a simple advice like to bring about some changes in your lifestyle to something as drastic as need for an IVF. Lifestyle parameters would be something which is basically applicable more or less to everyone. Healthy eating, exercise, quitting smoking and alcohol. These are some of the things which might sound difficult, but I'm sure everyone stands to benefit from it, especially those who tend to lean towards being overweight or obese. because they tend to benefit more from such interventions. So definitely patients who are suffering from PCOS and patients who are having impaired hormonal balance, they would be the ones who would be specially encouraged to go on for lifestyle modification. The ideal body mass index in order to conceive would be somewhere between 19 to 25. We normally do not give treatment if the patient is having a BMI of more than 35. I know it sounds very difficult to come and shed down to that much, but it is in the patient's best interest because we're not only looking at getting a couple pregnant, but also at having a healthy pregnancy henceforth. So it's very important to be in the healthy weight range. So besides the lifestyle interventions, for patients where we have diagnosed the couple as having a polyp or a fibroid, depending upon the location of the fibroid and the size of the polyp, it would be imperative that we try and remove it. A polyp can be removed by a simple surgery which is known as a hysteroscopy, whereas a fibroid is usually removed laparoscopically by a surgery called as a myomectomy. Your doctor would be the best person to let you know whether you have the kind of fibroid which needs removal or which might be impacting your fertility. The other options available are in cases of patients with endometriosis, depending upon the size of the endometrioma, and to help with the tubal evaluation, the couple might need a laparoscopy. If you have an isthmocele, which is impairing your fertility, well, in that case, a surgical correction might be required either hysteroscopically or laparoscopically. Patients who are having difficulty with ovulation might be advised to go for ovulation induction protocols where we give the patients medications for about, say, 5 days in a cycle in order to make their eggs grow. The couple is then monitored, the wife is monitored by regular ultrasound scans, and when the follicle is about 20 millimeter or more, a trigger injection is given. The couple is advised to have timed intercourse around this time, and post-ovulation they usually give luteal phase support. If we diagnose the couple with having unexplained infertility or some form of mild male factor, then in that case, IUI, which is known as intrauterine insemination, would be really helpful in trying to improve your chances of conception. What is done here is basically that the semen is processed in the laboratory and it's instilled into the uterine cavity around the time of ovulation. So basically what we're trying to do here is put a good quality of semen inside the uterine cavity as close to the ovulated follicle peri-ovulation. So per cycle of IUI, usually your success rate would be between about 10 to 15%. It's very important that when we are doing an IUI, we test the female for fallopian tube patency. So that's one of the things which we need to be sure of. How do we decide that who is the right candidate for simple treatment or just for lifestyle modification or for an IUI? Well, the main guiding factors to help us determine what kind of treatment to prescribe to a couple, it's mainly determined by the age of the female, by her ovarian reserve, which is again determined by her antral follicle count and a blood test which is known as an anti-Mullerian hormone levels, as well as the semen parameters of the male partner. So if you are someone who is still relatively young and who has a good reserve, and the male partner has normal semen parameters, well, in that case, you might just respond to simple lifestyle modification and ovulation induction protocols. If it has been at least 2 years of you trying such simple treatment, we might need to move on to something called as an IUI. Or after 6 cycles of ovulation induction drugs, if they're not really helping you much, you might need to move on to an IUI. IUI is usually helpful for those patients who have unexplained infertility, where the male's semen parameters are mildly deranged, and once we have determined that the wife's tubes are patent. If you're someone who is not responding to about 3 or more cycles of IUI, the wife's ovarian reserve is reduced, is markedly reduced, she is of advanced maternal age, and the male's semen parameters are severely compromised, well, in that case, we might have to resort to an IVF for you. But an IVF is quite commonly done nowadays, and I can assure you it's not something which is to be dreaded. It's fairly safe. With modern regimes, the risk of any complication with it is almost negligible. So, what it mainly involves is giving the female partner injections for say about 10 to 12 days to make as many eggs as possible grow in the particular cycle, and once they reach a certain size, those eggs are retrieved from the ovaries. The eggs are combined with the sperms in the laboratory by a procedure either which is called as an IVF or XC. The male partner would be giving these sperms preferably on the day of the pickup itself. So these sperms are combined with the eggs in the laboratory to result in the embryos, which are further cultured in the laboratory for up to 5 days. Now, based on the number of eggs which have been retrieved and the hormone profile of the patient at the time of the egg retrieval, we might either do something called as a fresh transfer, where the transfer is done in that cycle itself, or we might do a frozen embryo transfer. The success rate out of IVF would be as high as about 40 to 50% based on the age and other parameters. So out of all the treatment options which are available, this would be something which would be having the highest success rate. We would also have some couples where the couple desires to have another child, but the wife is either suffering from premature ovarian insufficiency or her reserve is so low that it would be impossible to use her eggs to help them get pregnant. Well, in these cases, the option of donor egg would have to be discussed with the couple and considered. In case the husband's semen parameters are severely compromised and it's not responding to any of the options like we have of retrieving the sperms directly from the testes, but in that case, we might have to resort to donor sperm option after discussing with the couple. In very rare cases where the wife's endometrium is not growing or there are some other issues with the uterine cavity because of which carrying a pregnancy because of either medical or because of any other physical causes is impossible, well, in those cases, surrogacy is something which can be considered. So that's in short, in brief, about secondary infertility. If you're someone who's suffering from it, there's just one thing which I would like to say, and that is that firstly, stop blaming yourself for it because there's nothing really to be gained from it. It is fairly common diagnosis and you're not alone. You need to first and foremost open up, discuss it with your partner, seek medical help, discuss it with your doctor, and trust us to treat you with the right interventions for this particular ailment. Thank you. I think we will now be open to any questions which you might be having regarding this diagnosis. If anyone has any questions, we would be happy to take that. Okay, if anyone has any questions, they can leave it in the chat box and we will get back to you. Thank you.